Hello, everybody. Welcome back to the World Health Network YouTube channel. My name is Ben Calderwood. Today's roundtable is a continuation of sorts of a discussion that we started not long after the 2024 US election. You can find the link to that discussion in the description below. At the time, we were reacting to the results of that election and to people's very real concerns about the future of public health here and around the world. It's probably worth noting that since we recorded that discussion, pretty much all of those fears have come true. Today, we're going to try to look forward. We're going to pull back the curtain a bit here at WHN, introduce you to some of our team leads, and have a discussion about some of the projects they have in the works for 2025. At a high level, we'd really like to share how WHN is building in 2025 in response to the ever-increasing challenges that public health institutions and indeed the entire premise of evidence-based public health is facing. If you enjoy these videos, if you're interested in the efforts of the World Health Network, please like and subscribe. Please follow us on social media. That'll really help us get the word out. And if you share these concerns and are looking to turn those concerns into action, we'd really love to have you here at WHN. We'll talk a little bit more about that with our guests today. And at the close, we have a few audience WHN member submitted questions that we're going to have the group answer. So please stick around for that. All right, preamble over. I would like to introduce Katie Marsh, who's joining us from Seacoast, New Hampshire. Hi, Katie. Thanks for being here today.
Yeah, thanks, Ben. It's great to be here, and I'm really so glad that we're doing this. We are looking forward to helping all get through 2025 as best we can. We have some projects and teams building to help address those issues. But first, a little bit about myself. I've been with the network since 2020, when COVID first came to all of us, and I've been honored and really grateful to have been a part of building this wonderful virtual community that we all are a part of. These days, I'm focused on mostly helping with strategy, helping with team building, and also organizing events so that we have town halls with our experts to answer questions about, whatever currently is happening in the public health space. If you're interested in joining, one of the best places to start would to come through our website and go to the Join Us section, and then you'll hear from someone, my dear coworker, Sharon Fitzgerald, and she will be welcoming you into welcome meetings and giving you directions on how to get working in the network. So I hope that you all consider joining if you haven't already. And for those that have been with the network, we really appreciate your time. Thanks. Back to you, Ben.
Let's go ahead and introduce Joe Eastman, who, I'm going to say this correct, is in Bovey, Minnesota, who leads the science data team. Welcome, Joe.
Welcome. Thank you, Ben. Yeah, it's been I've been with WHN for quite some time, over 2 years, and I've been working in science for over 40 years, and across many disciplines. And our science data team reflects a lot of that. So I'll let you proceed now.
We'll move on to Lisa Toth in London, in the UK. Say hello, Lisa. Thank you for being here.
I am really glad and honored to be here. Thank you. I'm the newest member of this team, having joined in July of 2024. I got involved because I saw the work that Joe Eastman was doing, our Joe right here. I was very impressed, and it finally dawned on me, I could help too. So coming out of some conversations with Joe and others in X Spaces, we decided it'd be really important for people to know the full breadth of what COVID can do to you, the dangers of it, and why it's different from a cold or a flu or anything else for that matter. And so I came on board and asked the founder of the organization whether there'd be some way we could work on a public service announcement to describe that. And he said, sure, just do it. So we did. We published the PSA on September 2nd. And we're now working on subsequent PSAs. That was a written document. We're now working on other ways of expressing related information and the same information that are more accessible to people, such as through video. And in my career, I was an intellectual property law attorney for 25, 30 years. But now I'm retired and dedicating my time, not all of my time, but a large chunk of my time to this organization, which is a fantastic organization, and I encourage everyone to join. Thanks.
Great, thank you. Final guest today is Frank Lancero from New Jersey, here in the United States. That's probably obvious to many of our viewers. Frank, please say hello. Thank you for being here.
Thanks, Ben, and thanks, everybody. I'm Frank, and I'm on a few teams, most prominently the campaigns team, the relations team, and the community action team at WHN. And I actually came into WHN through a call to action to join the campaigns team as it was forming, not this past fall, but the fall before that, fall of 2023. So I'd encourage others that are interested in joining WHN or maybe haven't considered it, but have seen WHN, just get involved and pop into different teams and sort of explore. Katie mentioned, joining a welcome meeting, and that's certainly a good way to do it. But we've got lots of meetings that are great gateways to get involved. So a little bit more about me. Throughout the pandemic, I've focused on COVID response and infection prevention, advocacy for the long COVID community, and just general preparedness for future crises.
Thank you, Frank. Let's go back to, if I may, let's go back to Joe. If we can chat a little bit more about the science data team, about some of the people that you're working with, and some of the initiatives that you have underway right now that you're working on for 2025.
Yeah, by all means. Yeah, there's 5 main components that we in the science team are working on. One of the first ones that you can see on our WHN website in real time is a wastewater project where Vincent has been the lead on this project. And we take the wastewater from the National Wastewater Surveillance System and derive new daily infections. This goes back to the beginning of 2021, so you can look at it historically. And then we have a national plots that people can look at of new daily infections, and also individual states that meet a certain criteria that we base scientific statistics are. They have to meet that criteria to get up there. We also have Germany in the wastewater new daily infections. A second component of our team is led by Layla, and she has created an agent-based model. This model can simulate transmission dynamics on scales ranging from an individual room to an entire community or city. And you can investigate different mitigation strategies, how effective vaccinations are, all kinds of things. It has great potential, and that also is available on our website to interact with on your own. A third component led by David, he's working with his team on a prototype air sampler to detect COVID. And it mainly right now is monitoring CO2 levels in non-public buildings, restaurants, so to speak. And all this is in real time. People can look at it on their phone and even provide input, which I know David would really welcome. Another component of our team is led by Olga, and she has created a interactive website that has over 14,000 medical and peer-reviewed journal articles on long COVID, so that if people are curious, I have a certain symptom, well, they can go onto this page. It's called the Long COVID Observatory, and they can look up the symptoms and see what the peer-reviewed literature has to say about it, and investigate their own case or loved ones and other people they care about. And then finally, I lead a component of the science data team that is focused on forecasting COVID, SARS-CoV-2. And also, I'm just beginning to add influenza co-infections and measles. We are just putting this up on our website. It will probably be there in a few weeks, so people can go and look at not only the national trends of what is going to happen possibly in the next 4 months, but they can also go down, dig down to their state level. And I provide new daily infections at a very fine scale on the state level. And then we can even go further down to a single pixel, which is about 4 or 5 city blocks across. So it's been exciting work. I retired in 2019, just in time for SARS-CoV-2, and that's when I started developing my modeling system. So,
and that last project you were referring to, that's the MAPS project. Is that correct? That's what you were discussing just a moment ago.
Yeah, it's the multi-algorithm pathogen software that I developed and runs on high performance computers in parallel. And more, if you have questions about it, please ask me. I'm always available.
So most of these resources we know are, as you said, are available on the WHN website. That's whn.global. We'll make sure that specific links are available in the video description as well. All of these things are really cool and really interesting. I do want to ask you, looking ahead, Joe, if people would like to participate and contribute. You mentioned some of the people that you're working with. Are there ways down the road that people who have skills in these fields or who are interested in participating can reach out and get involved?
Oh, certainly. This most simple way is to join the WHN and then go to our weekly science data meetings. Everybody's welcome. And we relish the input because we want to provide the most useful, user-friendly interface that we possibly can. And, you know, they can also follow their own interests and propose projects and what they would like to see from the science data team. And the other thing is just helping one another with not only these efforts, but all the vast resources across the WHN. So,
Lisa, let me ask you a little bit more about your role and public service announcements at WHN and opportunities, roles that perhaps need to be filled on this team, ways that people can help get the message out through WHN. What are you and your team looking for in that department?
Oh, thank you very much. I'm really glad you asked. We're looking. I'm a peer with Joe. We both retired at the pandemic when the pandemic started. But what we really need, are a whole younger crew of people who are very media savvy, people who know how to express themselves through TikTok, X, all the different platforms that are out there. Because the way I express myself most naturally is in writing, which is very old-fashioned. And the PSA, you'll notice, has 40 references. It's very dry. It's kind of boring, I've been told. And so we need to find a way to communicate to people on a channel that they're more likely to receive the information from. So in terms of the content of the current PSA we're working on, it's based on data from Joe. Joe has, and it started off again in a space on X where we were talking about how much we could reduce the transmission of COVID if we masked, for example, or if people stayed home when they were sick. Just really very easy asks. And it turns out that not everybody has to mask to completely reduce the levels of COVID in the community. And why is that important? Well, it's important because that means so many fewer people will get long COVID. Because as it is, long COVID is a real problem, and it's going to be a devastating problem if things continue. And there's no sign that things aren't going to continue. So we have to figure out how to talk to people so that they can hear us and don't just shut us out and say, "Oh, don't bother me about COVID." So we need a young generation of people to help, and we do have a couple of superstars on our team. There's Emma and Stephanie, and Emma is an engineer from MIT, and Stephanie has had all kinds of experience doing educational maths and maths and physics videos and all kinds of things. So these two people are helping to translate the work that Joe did in terms of data and transform it into a video that people will understand. And then we have Becky, who's going to be the voiceover. So we've got a team of people, but we need more people. We need more video savvy people, people who can make TikTok, people who have science so they can take data from Joe and help bring it to everybody so everyone can understand it. So that's what we're looking for, and the more the merrier. And yeah, encourage anybody with a creative streak, and particularly with a creative streak and a desire to learn and to teach, to come join the PSA team.
I'll add very quickly. Thank you for giving us some more information about that, Lisa. As speaking as a member of the broadcast team, I mean those skills are of course invaluable for the broadcast team as well. People who are eager to communicate, and also I think translation, that word you used, I think that's very important when we're talking about high science clinical information, and we want to figure out how to translate that so that it's more consumable by mass audiences, and easy to communicate across all of the forums that you described where the young people live, in TikTok and X and so forth. So I think those skills for individuals who wish to join WHN and participate are going to be useful across the organization. Frank, let's turn to you now. I think like a lot of us here at WHN, you have your what's the metaphor I'm looking for? We have many kitchens, and you're in a lot of them. Tell us a bit more about the various teams you're working on and some of the initiatives that you have planned for 2025, please.
Yeah, certainly. I'll do my best to give a little snapshot here. I don't know if I'll do as good a job as Joe and Lisa. That was fantastic, but um, and also good to hear about the broadcast team always, Ben. Yeah, I mean, I'll touch on the three teams that I mentioned earlier. There's the relations team, which is one of the newly found teams, and the point behind the relations team is that it develops relationships with external organizations. So currently, we're developing a process where people at WHN can serve as liaisons to work across sectors, work with different organizations that are doing similar work or have overlap in mission to WHN. I'll also say, currently what the relations team is working on is we're closely working with different organizations that are fighting mask bans and supporting the right to mask. Mask bans have been popping up all over the United States. There's signs of it potentially in other areas around the globe as well, so we're carefully monitoring that. But very important to have a team like the relations team where, we're doing this work internally, and WHN certainly, has its own network that we're working within. But just as important as the work that we do within organizations is the work that we do across different organizations, and that's what that team's all about. The campaigns team, I mentioned, that's the team that got me involved in WHN, so I'm very fond of it. The main thing we do there is ideate and execute on campaigns and messaging that needs to go out. So we're working on a number of campaigns. We're always working on a few campaigns. And what we've begun to do is the number of campaigns and projects that we're working on have exceeded the number of people that are actually part of that team. So we've expanded to form working groups that are getting things done asynchronously outside of our regular team meeting. Just to paint a picture for people who are unfamiliar, we have different types of campaigns at WHN. If you check out our socials, you'll see a lot of the information that goes out through these campaigns. Some of the purposes are education and awareness. Other campaigns might be action and advocacy, or just different tools and services. So those are the three main categories. And, for education and awareness, one of the things we do is, just keep people up to date on why they should continue masking, or what they can do to clean the air, or just inform them generally about these topics, even going more 101 on that, like what is cleaning the air? How do you ventilate? How do you filter the air? Long COVID awareness campaign. So these are education and awareness. And then in terms of action and advocacy, I would say the bulletin board campaign, where we have different resources from different creators. It's actually on one of our web pages. So maybe we'll pin that in our description at the bottom of this video. But that's action and advocacy. And then finally, the tools and services. We have a COVID safer provider database that we're building out. Would love if people were curious about that. We could get them involved in it. And also COVID meetups is another campaign as well. which was birthed out of the pandemic, COVID meetups being a space where people can connect with other COVID conscious individuals. So that's campaigns, and we're always working on something new there and making sure that we're getting messaging out. I'll also touch on community action briefly.
Yep.
This is really just a great team meeting for people to join if they're new to WHN. If they have ideas for how to organize, whether it's within WHN or outside WHN, and also if they just simply want to find a space for community. I think that that's been something that has been disappearing as the pandemic goes on, and these spaces don't necessarily get to continue. So we want to make sure that we're kind of creating a space for WHN members by WHN members. And really, it's a great meeting for walk-on topics as well. It's a great space for support as well. And I'll also mention just briefly that the latter part of the community action team meeting has been a space where we've taken community action, and we've actually done phone banking to fight mask bans. So it's connected to the relations team in that way, and the campaigns team as well. So a lot of the teams, these are all teams actually of the ACT division within WHN. And as you can tell, there's a lot of interconnectivity between them, or among them, I should say.
I thank you, Frank, for giving us that kind of high level overview of a lot of the work that's going on at WHN. I think, I mean, you've identified, and all of our guests today, I think, have identified a lot of things that are critical to the way that WHN does its job. I think interconnectivity, as you just mentioned, is really critical. And you talked about community, of course. We're going to talk more about that in just a second. And really fundamentally, this effort to identify gaps in public health services for people and make an effort to fill them at a very high level. That is what WHN is making an effort to do, especially now, of course, for the reasons that we talked about at the beginning of this discussion. Katie, let me turn to you, and let's sort of, taking off on what Frank was talking about just a moment ago about sort of the importance of community within WHN. Let's chat about that just a little bit more as it pertains to just the nature of community building within the organization in general.
Yeah, thanks. This is one of my most dear to my heart areas here at the WHN. I'm a social person by nature, and I love to just see our members chat and build friendships. It's amazing. So I think some of the most important talks and ideas and discoveries come up when we just have our social time after our daily call. So we have a daily call that folks can sign into at 5 p.m. Eastern time every day of the week, right? So there's a real sense of belonging. There's a real sense of uh, just being together. During this time through the pandemic, a lot of people are not able to do as many social activities as before, or they find themselves not finding a lot of like-minded community to be with. And so one of the best things here is that you can find that here. We also do some fun stuff. We have movie nights on Discord. We're going to be creating more social hours on Discord soon. We have holiday parties virtually, everything's virtual. So yeah, if you don't feel you have the capacity to, you know, to do phone banking or to write for a PSA, or you don't want to go on camera and be part of broadcast, that's okay. You don't have to have a PhD or do data science or be a biologist to be a part of the WHN. You really just need to be you, whoever you are, and you may find a way to contribute, and it's just amazing to show up and just be part of our conversations. We have moms, we have folks that are disabled at home, we have just all kinds of people that are interested in art. So really, whatever your skills, whatever where you're coming from in life, there's definitely a spot for you. So come check us out.
I think that topic, that very deliberate intention to create an inclusive, safe space for people during the pandemic where they can participate, even if they do not have explicit skills, scientific background, etc., that there are still ways for them to be a member and contribute. I think it's a great way to kind of close this little portion of our discussion today. So thank you for reminding our audience of that aspect of WHN, Katie. Before we move on, I just want to be sure, I want to ask all of our guests is there any, I want to make sure that we're not skipping over any topic that is near and dear to you at the work that you're doing at WHN. If we skipped it, please let me know. We'll make sure to mention it right now. Just want to give you guys that opportunity before we move on. Do we cover everything? Sounds like we did. So let's move on to, so as I said at the opening of the broadcast, when we do these roundtables, we like to solicit questions from WHN members on the topic. I will say that many of the responses many of the questions that we received from our members this time around really were along the general topic that we've been discussing today, which is to say, how is WHN responding to the circumstances following the election, the circumstances surrounding the further erosion of public health in 2025 and beyond. And we hope we've kind of highlighted, at a high level, how we're moving into the new year in response to that. Let's chat about just a couple of more specific questions. Let me ask the first question here that comes from Nikki L. Nikki, thank you. Nikki was remarking on that there was no surprise, she said, regarding the reports of COVID infections at the recent SNL 50 anniversary broadcast, if y'all saw that. And she was just curious, what can we do to counteract the mindset of people believing that the pandemic is over and believing that even if they do get sick, they're not infectious and it's not something to worry about. And as I ask these questions, I'd like to open it up to all of our guests to respond. Katie, go for it.
Yes, thanks. That's a great question. How I personally tackle that question is in my own circles of influence. So on Facebook, I'm in several local mom groups here in New Hampshire. And I see moms asking, like, why is their child sick for so long? Why do they keep getting sick? Why have they been sick for 6 weeks in a row? Is this normal? Like, and I simply, comment in a way that's supportive and just suggest things like, COVID is going to impact someone's immune system for some time, after. So I try to make a difference where I can locally, with my friends and family, and just by modeling my behavior. So that's a real, like, local thing that I do on a personal level. But I know there's other work that's being done in the network that's far reaching with social media and other campaigns. So I'll let others talk about that. But those are some tips that everybody can do starting now. So thanks.
Katie? Frank, Lisa, or Joe?
Yeah, I'd like to chime in. Thanks, Katie, for that. I think you teed me up really well there. I'd just like to start off by saying, first and foremost, Katie's nailing it in terms of talking about how different communities can actually operate to support one another and how people can serve as trusted messengers within hyperlocal communities to make sure that people are getting trusted, reliable information. The SNL thing, yeah, it's, as Nikki had mentioned, no surprise, right? To me, this is an example that highlights the need for continued, persistent, and accurate public health messaging. Earlier in the pandemic, organizations and people across all different sectors were mobilizing within and across different communities to message as best they could about COVID. And that's kind of gone away at this point in the pandemic. It's still ongoing. We're still seeing tons of infection. We're still seeing a lot of people that are getting disabled with long COVID. We're seeing a lot of people who are still dying from COVID in large numbers. And so I understand that some people do have COVID fatigue when it comes to that. Some people are more apt to pay attention to these things than others in terms of public health messaging, but we need to continue sharing new information as we learn more. And that's an important point as well. We do continue to learn more. But one last thing I'll say is that we need to continue messaging about the COVID basics. I think persistence and continued messaging is key. People do need that repetition because, depending on which pocket of the population you speak to, some people are, have moved on from really important actions that they should be taking, like cleaning the air, like masking, things that they can do to prevent infection, whether it be acute infection or infection that ends up resulting in really serious long-term harm and damage.
I thank you, Frank. I think you'll find very, very quickly that for people who spend time looking at WHN on social media, looking at our website, you'll find that we hit all those points as best we can on a regular basis. That really is kind of core to WHN's mission, as all of our guests have pointed out, regularly throughout our discussion today. Lisa or Joe, any additional thoughts on Nikki's question?
Yeah, as a scientist, my job is to provide all the folks like you all here with the best scientific information that I possibly can, and then allow you to disseminate it, like Lisa's doing with the masking study and things I do. But contrary to what people might think, I'm not reading or modeling all day like some people tend to think of scientists do. I have different outreaches. I host a space on X every night with Becky, and she's another WHN member, and we've developed quite a gathering of people where they can come and really feel safe with each other and share information, stories. It doesn't have to all be science. I'm kind of there to provide that aspect, but Becky is really good at the social end of things. And one final thing that I do is I write a Substack, and I try to inform all the subscribers, and they pass it around. It's hospitals, doctors, all walks of life read my Substack. And currently, my big focus right now is to increase long COVID awareness through the Long COVID Awareness Day, March 15th, and the entire month of March. So I will repeatedly be hammering on that to inform people about the what results from long COVID and all the stories and what they can do to organize and help out the effort both locally and internationally.
Thank you, Joe. Thank you. We'll make sure we get the link to your Substack in the description for this video, along with all the other links, of course, that we've discussed throughout our video today. Lisa, any thoughts on Nikki's question before we move on?
Yes, absolutely. It's an incredible service that Becky and Joe provide in the X spaces. And as I mentioned, that's how I got involved. It's basically like, imagine a big virtual living room where you can go and just be comfortable. You can just listen to what people are talking about. You can participate if you want. You don't have to. But it's a very nice community, very warm, welcoming, understanding. Becky and Joe run the living room very, very efficiently and very well. So everyone who wants to talk can have a chance to talk. And it goes for really a few hours. And for quite some time, I would be listening to this living room as I would go off on my morning walks, and then coming. That's the first thing in my day. And then at the end of my day, coming to the daily call, I felt accompanied all the time. And it's important to feel accompanied when you're the only one in your immediate circle, or you or your husband, when there's just one or two of you in your immediate circle who mask and who understand what's at stake. It can be very, very alienating. And this is really the antidote to that feeling of alienation. And I think as more and more people find us, whether it be on WHN, whether it be in Joe and Becky's spaces, or, when I have another hobby, which is I do languages and I do them online. And, I don't hesitate to casually mention WHN at just about every meeting, just to let people know, oh yeah, this is what I do. Yeah, I volunteer. I was a lawyer, but now I volunteer my time for World Health Network, and World Health Network is trying to protect everybody from getting, really sick with long COVID, because that's the direction we're going in. And people don't really want to hear, but little bits. I hope little bits of information get through. What's really quite fascinating is that every one of my language classes, there's so many people who are sick and getting sicker. You know, I have one semi-private class today, and both the teacher and her whole family, and my colleague, who's the other student, and her whole family have been sick for weeks. And you know, weeks before that they were sick for weeks, and months before that they were sick for weeks. So it's taking some time for the penny to drop, even amongst very intellectual, intelligent people. But hopefully, with the work that we do, if we keep doing it, the penny will drop, and things will change.
Thank you, Lisa. We do have one more audience question. I just very quickly, though, I do want to thank Katie Marsh for being here. Katie, I know you might have to drop a little bit early, so I want to say thank you now. If you do have to drop, thank you so much for participating in our discussion today. We're really happy to have you with us. Hopefully, we will chat more about these topics in the future. So if you do need
Yeah.
to DM, thank you.
Thank you so much. Thanks, everyone. Be well.
Cheers. Thank you so much, Katie. And our next audience question, well, our last audience question, comes to us from Janine M. Thank you, Janine, for sending this question along. Obviously, we know that, WHN, the World Health Network, not the only organization that is doing this sort of work. And Janine would like to know if there are any efforts to partner with similar teams doing similar work. Frank, I know you alluded to this earlier when you were talking about the nature of the work you do with the relations team. But Frank, Lisa, if you'd like to speak a bit more about that, answer Janine's question.
You gonna go first, Frank, and then I'll follow up.
Yeah, that'd be great. I would just say, you know, without going into too much detail about which organizations we're getting involved with, I would say that we have been doing a lot of work across the board regarding specific topics, right? I had mentioned earlier the fact that mask bans were popping up everywhere. We've been in coordination with different groups. I think specifically, there are some groups that are doing work regarding mask bans, but broadly, you have groups working all over the globe that are involved in different initiatives, and it's so important to remain connected. I'll mention Mask Blocks specifically on this effort because they distribute this resource. They want people to mask, and a lot of these mask blocks are just one or two individuals that are getting masks out to people so that they can protect themselves in their different communities. And so as mask bans are being proposed and potentially popping up in different states and cities, you're having these mask blocks who, in my opinion, have been really the unsung heroes of much of the pandemic, where they're almost entirely voluntary efforts. They're getting out there and making sure to get these resources to people. So in addition to fighting mask bans and being in coordination with them, and really playing defense in that respect by pushing back on proposed mask bans, we're also playing a little bit of offense in terms of the right to mask, right? Making sure that people understand they have a right to mask wherever they otherwise have a right to be. And we're seeing states, and we're working with groups in Massachusetts and Illinois. Those are the two states that have so far proposed right to mask legislation within their state legislatures. And it's important to make sure that these efforts continue to start rising in different states as well. So that's just as it pertains to masking and things like that. But we've also coordinated with different organizations on long COVID, adult long COVID and pediatric long COVID, which as much as long COVID is really not highlighted, pediatric long COVID even less so, unfortunately. And so we've been sure to work with different organizations that are highlighting efforts that are happening around all sorts of things, long COVID, masking, and other forms of infection prevention. Lisa?
Yes, thank you, Frank. And as Frank mentioned, we have a team. Frank heads it, in fact, that revolves around whose purpose is to liaise with other organizations who have similar goals that we have. So if it's something that interests you, if you have a team, when you ask this question, if you had a team in mind that you would like to liaise with or have WHN liaise with, then I encourage you to join the relations team and build those bridges. We're looking for people to help us build those bridges.
Good note. Thank you, Lisa. Joe, is there anything you'd like to add on this topic? Oh, I think you're muted, Joe. I'm sorry.
I'm sorry.
That's quite all right.
I've been working pretty closely with Dr. Mike Herger, who many folks have heard about, and
Sure.
we've kind of formed a little partnership and trying to keep cancer patients safe. from SARS-CoV-2, and in the whole medical institutions as a safe place where people can feel comfortable to go. I've also brought in a lot of doctors across the globe, and I invite them in to do what I call Joe Talks, and let them disseminate their information through the social media. And finally, I've formed a partnership with a public radio station, and I do interviews every couple weeks. And they are able to reach out to the Midwest and West Coast audiences. So we can all do a little part in just trying to promote what's in all of our interests. Thank you.
Thank you, Joe. And I mean, fundamentally, that's about community building beyond the confines, so to speak, of WHN itself, you know, which is something that Katie was talking about a little while ago, and how important that was to making people feel welcome and safe during these pandemic times. I did want to also very quickly, if I may, just sort of highlight something you mentioned, Frank. You mentioned mask blocks. That's a phenomenon and a term that I think individuals who may not be active in COVID conscious circles may not necessarily be familiar with. You should probably just block, BLOC, that is typically how it's spelled. If you are in need of masks, if you would like masks, you cannot get them, Google mask block and your town or your state. You'll probably likely turn up resources where these individuals are volunteering and distributing masks and other COVID resources for free. So if you're in need, please do search for that and learn more about mask blocks. It's a great resource. And it's great that WHN is, you know, involved in integrating with those resources. I think we're just about at the end of our conversation. I really want to thank, well, we thanked Katie Marsh already, Katie, who was here a moment ago and had to leave a bit early. Let me also thank Joe Eastman and Frank Blancero and Lisa Tove for joining us and discussing what WHN is doing in 2025. And once again, really, we hope that for those of you who may be feeling stress and concern related to the state of affairs in 2025 as it pertains to COVID safety, COVID awareness, and public health in general in 2025, whether as a result of the election in the United States or just the state of the pandemic more broadly, wherever you live, I hope this has given you kind of a capsule view of the fact that there are people who are making concerted efforts to focus on these things, to pay attention to these things, to keep themselves and their community safe, and that you are welcome to join. And that's really fundamentally what WHN is all about. And of course, as I often say at the end of these broadcasts, you know, WHN is, of course, a global organization dedicated to ending the pandemic as a global health threat. And as we've discussed today, that remit is kind of expanding to encompass public health more broadly in 2025. We really hope you'll check us out online at whn.global and consider participating. Thank you so much for watching. Thanks again to our guests, and we'll see you in the next broadcast. Bye-bye.